do this.
It sucks, but we have no choice. We'll do everything we can, as long as it's covered.
Yeah, and send him home maimed.
I'm not talking about the surgeries. I can't wear these scrubs. It was too hot with long underwear, but the feeling of them on my skin is much worse. I'm going to change.
Shaun, I'm kind of in the middle of something.
American Society of Microbiology, Mayo Clinic, Clinical Microbiology. All show the use of paper towels results in lower rates of contamination than jet air dryers, and foaming soaps are less concentrated, which reduces effectiveness. Added fragrances increase allergic reactions, and synthetic fabrics can be abrasive and contribute to microplastic pollution.
Shaun, we talked about this.
Okay, you made these changes without asking us first because you're not trying to help us or protect patients. You're doing it to save money, and it's wrong.
Shaun.
Okay, you're wrong.
I'm so sorry. He's just really passionate.
You're wrong!
It's okay. You're right.
Okay.
I didn't ask the staff here, but I did ask other experts whose research proves I'm not wrong, but that doesn't mean you are.
We can't both be right.
Yes, we can. Because some doctors are different. And sometimes your ASD gives you
No, thank you. It's not my ASD.
Yes, it is. But if you'll just let me finish, I was going to assure you that I'm not dismissing you. I value your unique perspective because my ADHD gives me a unique perspective. You could be a great asset to this hospital, but only if I'm able to recognize that one size may not fit all.
It's not the size of the scrubs.
I'll have maintenance put back the old soap and paper towels in the residents' locker room and break room. And you can go back to wearing your old scrubs. But just you. Is there anything else I can do for you? Shaun?
I have to go.
Ligate the right sphenopalatine.
We need an ultrasonic scalpel.
Where have you been? We've been paging you.
I get to keep my old scrubs. Also, we can create an osteomyocutaneous flap, so we won't need the customized PEK implants. It should be strong enough to allow him to have full vision function and eat normally.
That's pretty brilliant. And fully covered by his insurance.
I know. I also convinced Salem to put the old soap and paper towels back.
Nice work.
Who needs the ultrasonic scalpel?
Me. Wolk, you're with me. Alan, help Murphy harvest the graft.
You were right. I should have listened to you and Andrews.
Oh, your confidence is just one of the things I like about you, especially when it allows you to admit that I'm right.
And what are the other things?
Oh, should I tell you or show you?
I'm surprised he'd agree to that.
I'm sure he didn't.
you do Dr. Murphy's plan from before? The right hemicolectomy?
We missed our chance. Now we have to do a full colectomy and or section of most of the small bowel. It's the only way to prevent another perforation that would kill her.
I read a case report where they're using prokinetics and acetylcholinesterase inhibitors to strengthen motility in kids.
That could help, but it wouldn't be enough to overcome the pressure from future obstructions.
We just reduce the pressure. Okay, we can put tubes above and below.
I'm not following.
Because it makes no sense.
Shaun, let him talk.
Suctioning above and below wouldn't reduce the burden of a focal obstruction.
Don't tell me what I'm getting wrong. Help me find a way to do this.
Look, this is the affected part of the bowel. Yeah. Stop it. Stop it. Please stop it. Stop it. Stop it. Stop it. I am trying to help your daughter.
Dr. Murphy, you need to leave.
No, I do not need to leave. He does. He made us give her rituximab, and it made her sicker. Why are you even here? You are not a doctor!
I thought you'd be different. That's why I asked for you.
You did not ask for me. Your father did, and that was because...
He had like 6 doctors that he liked, but I saw the billboard and said it had to be you. Because you were different, like me, and you'd think different. And we needed that.
I was wrong about the billboard.
Okay. That's good, right?
No, it's not. When I saw it, I thought it was dumb, and my ASD would inspire no one, but it did. It inspired the very first patient I saw, and if I wasn't being rational about that, maybe I wasn't rational about this case. Maybe my emotions got in the way. I shut him down. I wasn't open.
I'm sure you were fair.
No, I wasn't.
When?
The whole time.
Okay, Shaun.
I yelled at him. When he was talking about the pressure in her colon, it made no sense. He did not know how it worked.
Well, if it made no sense...
It must have made sense. Somehow. He's very smart. He must have been thinking of something that...
Begin the excision of the large intestine. What the hell?
Hey! Have you ligated any critical vessels?
We were just about to.
That is good. You need to insert a PVC tube to the colon.
A feeding tube? She can't absorb nutrients.
To feed her as an outflow mechanism.
Pressure valve for emergencies. It'll keep her GI tract viable.
What about the muscle weakness?
It's what Walt said. We use the prokinetics and acetylcholinesterase inhibitors to increase contractility and movement.
Walt, I'd like to revise the surgical plan and invite Dr. Murphy to scrub in.
Yes, to both.
No bleeding, no bruising, no signs of infection.
Thank you so much, both of you.
We wouldn't have gotten here without you.
Dr. Murphy, don't you think my dad would make a great doctor?
I'm not sure. He had some very good ideas, but also some bad ones. He is a very good father, though. One of the best I have met.